very, very important. You know, Dr. Nelson talked about the neuropathology laboratory and making discoveries, and the bench science researchers taking everything that we've got, all the clinical data, the blood samples, sometimes brain tissue or spinal fluid, and the laboratory researchers are just working away. But they're not working to just discover discoveries. They're working so that those discoveries can lead us towards a cure. So I think that's very important. And I think, you know, we have a timeline here. The timeline, you know, really extends back to the 1970s, but in 1985, the Sanders-Brown Center on Aging in UK was one of the first 10 Alzheimer's disease centers funded by the National Institutes of Health, and that's fantastic. I came on board in 2005, and that's why I kind of start my timeline there. In 2005, there actually were no ongoing active clinical trials at the University of Kentucky. They had all been outsourced to the community in a scattered fashion. It was at that time that the dean of the medical school and the executive vice president for health affairs called me into their office. I thought they were going to fire me. It was too soon. I was just hired. But what they said was, Greg, we need to find a cure for diseases like Alzheimer's. We need clinical trials. By 2010, we were one of the most active centers in the world, not just at the basic science end of things, which we had been for decades previously, but by 2010, we were one of the most active centers in the world, testing dozens of potential cures and treatments for Alzheimer's disease using many different forms of medicines. And we haven't stopped or slowed down, and we've seen progress. By 2015 or so, it was clear that we were able to remove Alzheimer's disease plaques, those little brown globs that Dr. Nelson talked about in the brains of patients. And this is really critically important. We have many people right here in Kentucky who we know came in with a head full of Alzheimer's plaques, and that we have removed those from their brains. That's wonderful. But we also at that time began to learn that it really isn't all about Alzheimer's disease. We've got to do better if we're going to stop this, as Dr. Nelson said. So in 2020, we're moving closer to possibly preventing Alzheimer's disease. We'll see what the studies that are ongoing eventually tell us. And we're also looking at new treatments for tackling not just Alzheimer's disease, but on diseases like late and vascular cognitive impairment and dementia, what we used to call hardening of the arteries. And truly, by 2025, which is the current national target, we'll see what we can do to get some of these medicines out there. I don't know if we're going to make it all the way, but we're doing it. We're pushing forward. The work that we're doing, the volunteer work that each of you who are engaged in our research is doing, is really to find cures, not just for Kentucky, but for the entire world, for all of our children and the generations to come. So we'll go back to some of the work that Dr. Nelson laid out, and I'll do it in a little bit more cartoonish of a form than Dr. Nelson did. We could take a look at what happens to us as we age. And if we think about just coming down with memory and thinking problems, there's some good news out there. About half of us are not going to ever have a major memory or thinking problem in our lifetime. Not mild cognitive impairment, not a form of dementia. That's wonderful. The bad news is the other half of us may well come down with a major memory or thinking problem. So this is the construct that we've thought about over time, but unfortunately, there is worse news. The worst news is that many of us, while we're still thinking and performing normally on memory and thinking tests, may already have early changes in our brains, plaques, tangles, late pathology, alpha-synuclein or vascular disease. And so if more of the population lived longer, which we're seeing every day, dementia is going to become a growing problem over time. So unfortunately, I had to share the bad news and the worst news with you all. But if we don't understand the problem, we really can't come up with a solution. So we have to understand, as Dr. Nelson said, what's going wrong with 3/4 of us in terms of our health and our brain aging as we age. Well, we know, as Dr. Nelson has already shown us, that about half of those with brain disease will end up having Alzheimer's disease. That may be pure Alzheimer's disease, which Dr. Nelson, as he said, is relatively rare, or it could be mixed with other pathology. We also know that about 1/4 of those are going to have vascular cognitive impairment or dementia, small vessel ischemic changes, even without a clear-cut stroke, but this hardening of the arteries that leads to abnormal function of the brain. And we know, as well as Dr. Nelson was talking about, that there are other diseases like late. So this parcels out, and now with the work that many folks have done, a lot of this really driven by our own Dr. Nelson here, we know that we can parcel out these diseases, and that finding a cure for Alzheimer's disease is going to help, but how much is that going to help is a real debate in the field. So we can look at Alzheimer's disease, and I'm just going to use a prototypic example. This is an antibody designed to remove amyloid plaques from the brain called BAN2401. We've been working with this medicine here in Kentucky for probably, going on about 8 years now. It is in its final phase 3 studies currently, being hampered somewhat by COVID, but we're not dismayed, because while we all know that COVID is lethal in 4% of those who are infected, we know that diseases like Alzheimer's are 100% lethal. So if we need a vaccine for any disease out there, I think we need one for Alzheimer's disease. This is a type of passive immunization. It's a controlled kind of passive vaccine. People come in and get infusions, and in the top 2 scans over here, we see somebody who came in. This is a scan, a PET scan, that shows amyloid in the brain, and that amyloid progressing over a 1-year period of time. But in the bottom panel, somebody treated with the medicine comes in with a brain full of amyloid, and again, a year later, that amyloid cleared from the brain. So we're currently working on this. We're working on this with a study called Clarity AD. This is the final phase 3 study. People with mild memory problems or early Alzheimer's disease may be eligible. The study's a lot of work. It's coming in every 2 weeks for an intravenous infusion of this medicine. And this work is expanding because we think removing these plaques from the brain may be most helpful if we get to folks early. And the earlier we get to them, the better off we'll be. These plaques begin to build up in the brain 10 to 20 years before a memory problem emerges. And so 2 new studies, the A3 and A45 study, will actually be looking at folks over the age of 60 with normal memory and thinking. And so we hope that those A3 and A45 studies may be able to prevent Alzheimer's disease by removing those amyloid plaques before they can start. And wouldn't it be nice if we could empty that Alzheimer bin and shove all those people back up into normal, healthy brain aging? That would be a tremendous success, but we're leaving a lot of folks behind, and that's not good. So we can think about vascular cognitive impairment and dementia. We can think about this hardening of the arteries. And over the last year or so, there's been a lot of excitement stemming from a major national study that was done called the Sprint Mind Study. This is a study that looked at almost 10,000 people and really looked at whether or not we could be very aggressive with lowering their blood pressure. Now, for some people, we can't drop their blood pressure too much or they get dizzy or the like, but in those that we can lower the blood pressure in, would this be helpful in preventing memory and thinking problems? So they targeted a systolic blood pressure, that's the top number, less than 120 millimeters of mercury. And that, if one thinks about that, you know, I can think to myself and I can say, you know, well, before I started taking a blood pressure medicine, the last time I saw less than 120 was when I was a teenager. But my brain was probably at its healthiest when I was a teenager, and I think that's critically important for us to think about. So this study looked at what would happen to memory and thinking problems if we were able to safely lower the blood pressure, and the data was convincing that if we can lower that blood pressure, we may be able to prevent memory and thinking problems in folks. We also know from some of the work that we've been doing here, we know that hardening of the arteries is actually very dynamic. It doesn't just come and then stay stable. You know, well, I've got it. It's just there. It can stabilize, but that's a relatively small proportion. It's only about 20%. 1 out of every 5 people might have stable changes. And here we show MRI scans, and there's little white dots. They're broken out. These are what we call WMH, white matter hyperintensities, and we can see them remain stable in most cases, almost 60% or so. We see this progress inexorably, just like Alzheimer's disease causes further memory and thinking problems. But what's fascinating is that 26% of people, this actually can regress, and we think that blood pressure is just one answer, but there may be other targets for vascular cognitive impairment that we're actively exploring currently, because we want to empty that bin. We want to empty vascular dementia and push that back up into the healthy brain aging category. But are we done? No, we're not done, because we've left a group behind, and we leave nobody behind. So really, on the back of the work that Dr. Nelson has done, discovering genetics of late, as well as describing the pathology, and in pink here, we see a nice picture of a healthy memory area, what we call the hippocampus in the brain of somebody with normal memory and thinking. And below that, we see this shriveled up, sclerotic memory area leading to problems. And it turns out that that may be linked to a potassium channel, a channel that can be regulated by currently available medicine. So several years ago, Dr. Nelson and I put together a grant to say, well, even though most people in the world don't even know that late exists, we're already working on trying to find a cure for it. So again, this is kicking into place, and hopefully the final data needed to support this grant with the Food and Drug Administration came in this morning. I was delighted to see that. I bet Dr. Nelson is as well. And hopefully this will be up and running in just a few weeks. UK is the only place in the world where we are treating late currently. We'll get the rest of everybody on board, because what we've really tried to do is take all those people with late and get them back into that normal, healthy brain aging category. Now we're styling. Now we emptied those bins. Let's get to work.